there is a possibility it's going to be in the community somewhere sometime in the upcoming months. So things may change as well. But I think we're given the past experience and the current expansion of the vaccine, I am still optimistic that we shall be able to meet most of you very soon. Okay, just to give you some stats about the NTU. So the NTU was founded in 1928, and currently we have more than 30,000 students from 11 different colleges. Okay, so the College of Public Health is one of the 11 colleges, and it's located in the downtown of Taipei. And Taipei is relatively a very friendly city, very, very safe, lots of nice food, and the cost of living is relatively low. I mean, in terms of the major metropolitans in the world, but within Taiwan, it's still relatively high. So the CPH is the first College of Public Health in Taiwan, but also importantly, we are the first institution in Asia to be accredited by the CEPH, Council of Education of Public Health. And so we are also a member of the Association of Schools and Programs of Public Health in the US. So I think all of you applied to our program through the SOFAS. So the NTU College of Public Health is a college of different spectrums. So spanning from the undergraduate, the Department of Public Health. We actually started the undergraduate program more than 40 years ago. Many of our professors graduated from this undergraduate program. Then we have the semester level and the PhD level programs of different disciplines, epi and biostats, health policy and management, environmental health, and food safety and health. So that's the sort of the building block and cornerstone of our program and the undergraduate program. So the global health program offered two different degrees. One is the master's degree, the Master of Science degree, and the other is the Doctoral of Philosophy, or the PhD. And we are a fully English program. And so all our students are international students from different countries. But most of the other programs within the college are given in Mandarin, although there are also some international students in other programs who speak Mandarin. And just very quickly about the academic staff members. So in terms of leadership, the dean is Zheng Shouxia. He is an expert in health care and the national health insurance. So he served as the director of the National Health Insurance about 10, 20 years ago. And there are four vice deans, and three of them represent the major teaching units. So Dr. Huang is the current director of the MPH. So we have a Master in Public Health program, but primarily in English, in Mandarin. And Director Zheng Yawen is the director of the undergraduate program, Department of Public Health. And I'm currently serving as a director of the Global Health Program. So three of us are also serving as the vice dean, showing the emphasis of the college on the three programs. And so within our program, we have three associate directors. You'll get to know them very soon. Professor Zhang Qingguo, Professor Li Wanzhen, and Professor Guo Nianzhen Raymond, and all the other professors. And we also have a project assistant professor, Rita. And so Rita will help moderate the rest of the session, so you'll get to know her very soon. And we also have several adjunct faculty members, both from the academia and also from the field. And in terms of opportunities for you, we have several major awards, including the awards for students to attend international conferences. So if approved, we sponsor flight tickets, accommodation, registration, etc. And we also have a poster presentation here in the NTU. And if you publish your work in journals, that can also be the publication fee can also be supported, and also the field work. And there are also a lot of part-time work opportunities within the college and within the university. So many of our current students serve as a teaching assistant in one of the courses, either of the program or of other programs. And they can also help with our office as a research assistant, or to help with some of the administrative work. And so briefly, the students here will earn a master's degree within, I would say, 1.5 to 4 years, and a PhD degree in 3 to 7 years. So the required credits for the master's program is 24, and 26 for PhD students. So you'll know this in the future, but there are 6 compulsory courses corresponding to the core competencies of our program. And so they are designed to spread out across the 2 semesters in your first year. And so most of your first year will be spent in course taking. And in the second year, you will start to, hopefully you start earlier, but at least at the beginning of the second year, you'll start to work on your thesis. So by design, you should be able to finish your degree by the end of the second year. And in addition to the compulsory courses, there are a lot of elective courses provided by many of our faculty members. So I'm going to let the other faculty members to introduce their courses in the next session. So just many of them. Okay, so the graduation requirement for the master's program includes a total of 24 credits. So that consists of 16 compulsory courses, compulsory credits, and 8 optional credits. And then you have to complete a master's thesis, which is approved by the thesis committee. So this is a general, again, an outlook of your next 2 years. So in the entry year, you'll spend most of the time taking the required and elective courses. And the critical milestone is that by the end of the first semester, which is January 22, you need to identify your thesis advisor. So upon entry, within next week, we'll shortly notify you about your mentor. So in the first semester, you will have a mentor based on your research interest to work with you regarding course selection and regarding your research interest. But at the same time, you are also free to contact with other professors within our program, or even outside the program within our college, to identify the advisor that fits your research interest the most. And then by the end of this first semester, you will have to submit this thesis advisor agreement. So in the agreement, both you and the potential advisor will sign and commit to this mentorship. But before that, you can talk to as many advisors as possible, and you can set in their lab meetings and schedule meetings with them. And in the second year, again, some of you may take more courses, but you will spend a lot of time doing research. And if you want to graduate by the end of the second year, you will have to submit your defense application no later than April in the fourth semester, which is the 23rd. And you have to complete your oral defense by July, end of July of the 23rd. And then you have to submit your final completed and revised and approved thesis to our university library in order to get your diploma. So just to remind you that our program office is here to help you. So we will remind you of every important milestones. And so there's no need to keep that. And for the PhD program, the required courses overlap with some of the master's programs courses, but there are advanced courses that is required, including the advanced or applied research methods in global health and the other seminars and the dissertation. So again, there are the PhD students have to select from the different disciplines of the elective courses. So many of them. Okay, so for PhD students, there are several milestones. So first of all, you have to, of course, take all the compulsory and elective courses. So upon completion of the compulsory courses, you will have the PhD students will have to take the qualifying exams. Usually happen in the second year. So the qualifying exam will be include both the written exam, and then after you pass the written exam, you have to pass the oral exam, oral qualifying exam, which is essentially a proposal defense. And if your proposal is granted, the students will then focus heavily on the research work and the field work. And then usually it is expected that by the third or the fourth year for full-time students, they will be able to finish their dissertation and defend. And just to make another new announcement, the CPH, the NTU CPH has had a long-term collaboration with the Kyoto University in Japan. And so we started this double degree, it's actually a dual degree program between the CPH and the Kyoto University about 5 years ago. And so for the global health program, we started to join this double degree program officially next year. So, but for the students who are entering this year, you will have the eligibility to apply for this dual degree program. Okay, but the premise is that the students are better able to speak the Japanese because the courses in Japan are mostly provided in Japanese. So you will have to speak Japanese during your stay in the dual degree program. That's better. But if you do not speak very good Japanese, and they will also try to accommodate. So some of our former students, they're not very fluent or they don't speak Japanese, but they can still survive, but need some kind of adventure. Okay, so very briefly about the dual degree program. So usually people take about 2 or 2.5 years to complete the two programs. So you spend 1 year in the NTU and 1 year in Japan in Kyoto University. And by the end of the degree program, you have to complete 2 theses. So you have to complete a thesis to fulfill the requirement of the CPH, and you also have to complete the master's thesis to fulfill the requirement of Kyoto University. So it's rather challenging, but it's also very rewarding because you get 2 diplomas, one from the CPH and one from the KU. And the nice thing is that you only have to pay for 1 tuition. So for students from the CPH, you only have to pay for the tuition from the NTU side. And the other advantage is that at least so far, most of our students going to the Kyoto University get a very generous scholarship to support, to sponsor their living in Kyoto. So this is I think it's an exciting opportunity, especially for those of you who want to know more in Asia. Let us know if you're interested. The application will start next year. And in addition to that, we have quite a number of field work opportunities. Just to let you know that our program is a Master of Science program. So a internship is not a compulsory one, but optional. But still, we encourage you to explore these opportunities if time allows, especially during the break, like the summer break. And we have established ties with several institutions or programs within Taiwan, including the off-islands, Mazu, Taiwan, and Hualien. Many of you will be going to Hualien to the indigenous communities in one of our elective courses. And in addition to that, we also have connections with other sites, including Malawi, Myanmar, Tulane University, and Cambodia. So these are the established ties where you can explore the opportunities of internship. But again, you have to consider the current and upcoming situation of COVID, of course. And in addition to these established ties, you can also build your own internship or field opportunities either to your own countries or to other countries that you're interested in. And the program will be supporting you to make contact of them. Okay, and in relation to that, we have a number of international faculties who have been teaching in our required or optional courses constantly. So this includes Alan Lobes and Lennon Nicholson, who are experts from the Global Burden of the Disease, GBD, research team. And Winston Zhen from Berkeley, he will be teaching one of your compulsory courses. And Michi Fu, and also Ted Chen, who retired from Tulane University, and Xiong Zheng from Hong Kong, Chinese University of Hong Kong, Paul Luo, and An Ling from Myanmar WHO Regional Office. And as I said in the beginning, we have this relationship with CEPH and ASPPH, and we also have several international connections to very important organizations. So M8 Alliance is a important global health academic hub with the base in Germany, and there are international conferences from the M8. It's called a Global Health Forum or something like that, which we attended regularly every year. And there is a APRU, Asian Pacific Rim University Alliance, and we are part of the APRU as well. So through the program, you will be able to get connected to many other international organizations as well. Importantly, there's a lot of scholarship opportunities. So for those from the U.S., I'm sure many of you are aware of this Fulbright scholarship opportunity. And the Office of International Affairs, OIA, also provides scholarship specifically for international students. So make sure you apply every year. So if you get it, congratulations. But if you do not get it this year, you can also apply the next year. And also we have scholarship from Ministry of Education and Ministry of Foreign Affairs. So keep an eye on that. And for any questions, contact our program office. So just a very quick snapshot of our current students. Many of them are from the US through the SOFAS application, but you can see that we also have a good variety of students from many different countries. And it is the program goal to expand the diversity of the program. And again, you can see from the past 3 years, our students have been coming from many different countries, and the number of countries has been increasing. So this is just some of them. And importantly, I wanted to introduce a very important initiative, which is the INDI initiative. So INDI stands for Inclusion, Diversity, and Equality. So this initiative was actually initiated by 2 of our students from the 2019 cohort. And the program has been fully supported of this initiative. And Peter, one of our teachers, Peter Bohan, Peter Lee is now helping with this initiative. And so I'm asking Peter to give a more introduction of the INDI when he introduced himself. But this is just to let you know there are lots of different exciting opportunities and initiatives going on within the program. And you can also, because we are such a new program, you can also propose new activities. And one example is the Global Health Program's response to the COVID-19 situation, primarily in Taiwan. So as you know, in May, we have this surge of cases. It's not large compared to many other countries in the world, but it's still quite large for Taiwan. And the schools and other activities were affected. So I was very happy to find out that some of our students spontaneously take the initiative to try to help for this COVID-19. So our students took the advantage of their expertise in public health and our language diversity expertise. So knowing that the communication, the health information communication from the government sometimes did not emphasize so much about immigrants, workers, and immigrant populations from a good diversity of different countries. Our students helped to translate the important public health messages into many different languages from their home countries. And then we disseminated these information through many different channels and received a very good response. So as a program director, I'm so proud of our students to taking this initiative. And also from the faculty, of course, as you will see very soon, some of our faculty members are doing research on infectious diseases, including myself and Professor Andre. And so Professor Andre has been helping Taiwan CDC in timely analysis and response of the May and June outbreak. And his analysis has been used by Taiwan CDC daily to assess the risk of transmission and also in the daily press conference. So our program's response to the COVID-19 has been appreciated by our society. So with that, I want to close my introduction. This is just very brief. I welcome you to ask any questions during the Q&A sessions or now. So I'm going to stop here, stop my sharing. Okay. For time's sake, maybe uh, uh, I can answer one or two quick questions, and we can have this open discussion or question in the end. Any quick question about my presentation? Not yet. Okay. Maybe we can move on to the introduction. So I'm going to hand this to Rita. So Rita, can you help to moderate the rest of the sessions?
Yes, of course. Thank you, Dr. Lin, and welcome everyone to the Global Health Program in NTU. So we have the next section is for every faculty to give a brief introduction of the research and their other engagements so that you will have a better understanding of how the entire program works. So actually the first one is Dr. Lin. So do you want to
Okay.
take a break?
No,
I'll
I'm fine.
give back to you. Okay.
No, yeah,
So we'll start with.
I'm good.
Mhm.
Yeah, let me start. I'm not going to speak long because you know me already. So in terms of research, our lab mainly focused on infectious disease and epidemiology. So previously we have been mainly working on tuberculosis, one of the major infectious disease killers globally. But recently we had to spend some of our research time on COVID. And in addition to infectious diseases, we also work on the burden of disease analysis. So we are part of the Global Burden of Disease Research Network. And we've been working on both Taiwan and other international research in terms of disease burden. And in relation to our research, I teach two optional courses. So one is the COVID-19 response, which is provided in the fall semester. So in this course, we aim to not just focus on epidemiology, but focus on different aspects of COVID-19 through the lens of public health. So in addition to epidemiology provided by me and Professor Andre, we also have experts from environmental health to talk about the issues like aerosol transmission of COVID. We have faculty members like Professor Susan to talk about health behavior, especially mental health in the middle of the COVID-19. And we also have different experts from different countries to talk about their own country's perspective, etc. So it's a course of quite a good variety. And in the spring semester, I provided a course about disease burden analysis. So these are the two courses that may be of interest, and I also co-teach some of the compulsory courses. So I think I'll stop here, and I'll let other faculty to talk more. Thank you.
Thank you, Dr. Lin. And then the next up is Dr. Zhang Shushen.
Okay, thank you. So I'm going to share a few slides for some introduction of myself and the course I'm going to teach for this coming semester. So could you hear me well? Great.
Yes.
Okay, just a brief introduction of myself. And so I'm a faculty with the Global Health Program, and I'm also a professor and director at the Institute of Health Behaviors and Community Sciences at this college. I have a background in medicine, and I did my master and PhD degree in epidemiology and social and community medicine from Taiwan and UK, respectively. I teach for the coming semester. I'm going to coordinate the course of Social and Behavioral Foundation of Health and Health Care, which is one of the compulsory courses for this program. And in the in just this summer, the last summer, I also taught a course of global mental health and suicide prevention, which is my research focus area with our international visiting professor, Professor Michi Fu. I also the main instructor of two courses, social epidemiology and health psychology, at this college, but they were taught in Mandarin in spring semester. And my research focus include mainly focused on the research and prevention of suicidal behavior, and more broadly, community mental health and social determinants of health behaviors and spatial analysis. So just a brief introduction of my background. As I just say, I have a background in medicine, and I have my training in psychiatry at the National Taiwan University Hospital, which is the main hospital affiliated with this university. So I'm a board certified psychiatrist. And I did my master's degree at epidemiology at this college. And after finishing my PhD from the University of Bristol, I worked at the University of Hong Kong for 3 years at a research center focusing on suicidal behavior. Then about from 2015, I have been working at this college. And so I have a research focus on suicidal behavior and mental health. And I can summarize my research in 5 major areas. And I also use my some recent publications as examples. And the first theme is to identify factors affecting suicide trend. For example, in the recent publications, we study the trending suicide over the last 100 years, and we also, because of the COVID-19, we also did analysis on the impact of the 1918 flu pandemic on suicide rate in Taiwan. As you can see from the picture, back to 100 years ago, we use pretty similar prevention measures, including face masks wearing to protect us from this virus. And the second thing is to study the spatial variation in suicidal behavior. We use data from Taipei City and also from Manchester, UK, which is part of our international collaborations. And more recently, we try to identify novel risk factors, including COVID-19. For last year, suicide rate in Taiwan actually decreased against the concern about the impact of COVID-19 on mental health. Actually, we have seen some small reduction in suicide rate in Taiwan last year. And we also try to find novel risk factors in the cyberspace on suicide. For example, search on Google. And we also try to identify effective measures to prevent suicide, including the restrictions of very toxic pesticides. We use data from South Korea, and also based on that experience, we advocate for restrictions of very toxic pesticide in this country, in Taiwan, and we have shown some impact of its effect on reducing suicide in this country. So our past research based on international and local collaborations, particularly we work with researchers from the UK and Norway and Hong Kong, South Korea, and locally in Taiwan. We also get funding from international organizations. This is our recent grant funded by American Foundation of Suicide Prevention, focusing on pesticide suicide. So for this coming semester, I'm coordinating this course with Dr. Rita, and this Social and Behavior Foundation of Health and Healthcare course, as I just mentioned before, is one of the foundation courses for this program. It would occur on every Tuesday morning for 3 hours. It would be, as Professor Lin just said, for the first 3 weeks, all the courses at NTU would be virtual courses, including our course. So Professor Winston Zheng would be the main instructor for this course. He will be teaching virtually from University of California, Berkeley. So this course will cover the introduction of importance of social context and behavioral aspects of health and healthcare, and to use the social ecological framework to address multi-level influence on health and healthcare. So the 2 major themes to be covered by this course is first to introduce the social determinants and social and cultural determinants of health and healthcare. And we will also introduce theoretical foundations of health behaviors. We will use lectures and video viewing, and also include a field trip toward the end of semester, which will depend on the COVID situations. For last year, we are very fortunate to bring the students to one of the most deprived communities in Taipei, and to introduce the impact of community environments on health. And this course will also include special lectures by faculty members with expertise in health, in social and behavioral health from this college. And we will have faculty members from the Institute of Health Behaviors and Community Sciences to talk about a variety of different special topics in this area, and also Dr. Rita and Dr. Peter from Global Health Programs. So this course will offer you opportunity to know more about specialties and research focus of faculty members with focus in this area. And to, if you are interested in pursue your research in this area, this is also opportunity for you to identify potential supervisors. Okay, so this is my introduction. I'll stop here. Thank you.
Thank you very much, Dr. Zhang. Just like Dr. Zhang said, these classes are really helpful for you to identify your own research interests and also potential advisors. So pay attention in class and learn as much as you can. The next we'll move on to Dr. Guo Mianzhen. Dr. Guo.
Okay, good morning, everyone. I'm Raymond Guo. I'm one of the associate directors of GHP and also have appointed by the Institute of Health Policy and Management. I received my PhD in Healthcare Orientation Administration in 2010 and postdoc in the NTU Hospital and visiting scholar of UC San Francisco in the US before I joined as a faculty member of the College of Public Health. My room is 632 on the 6th floor of the CPH building. I'm happy to have a chat with you if you stop by there. As you can see in the figure on this slide, quality of healthcare, the purple square in the middle, is a core foundation of my previous studies. And it is linking to several topics concerning the delivery of healthcare and the performance of the healthcare system. I would like to mention that currently I have a 3-year project on the impact of COVID-19 on the utilization of healthcare in Taiwan. And in this project, I will compare the healthcare utilization before and after the pandemic of COVID-19. And I will especially look at the utilization of non-urgent treatment or elective treatment. For example, the replacement of knee joint. And this is because literature says a pandemic of these new infectious diseases could delay routine healthcare treatments, and patients might be suffer from symptoms of complications in the long run. So if you are interested in related topics, I'm happy to have a talk with you. And my previous studies are related to the payment system in our national health insurance programs, as well as the difference in quality and efficiency of care across different providers in Taiwan. I'm also specialized in the technique of risk adjustment, which is used to compare providers' performance in terms of treatment outcomes. And regarding the courses I teach in the College of Public Health, these are just a few of the courses I teach at CPH. For this cohort of students, we will meet in the Evidence-Based Global Health Policies course next semester, which I co-teach with Bohan and other adjunct faculties. And I also teach data analysis in health services and policy research for HPM students. In this course, students will learn how to use SAS and SPSS on our National Health Insurance Database and also survey data. Another course, Healthcare Payment Systems, is an elective course which introduces the payment systems widely used not only in Taiwan, but also in many other countries. Another course is an intensive course for our executive students, which is about data visualization and applying the software Tableau on presenting data. I look forward to meeting you in person soon. Thank you very much.
Thank you, Dr. Guo. And then we'll move on to Dr. Zhang Qingguo.
Hi, my name is Chinguo Chen, and sorry, I haven't prepared any slides to introduce myself. And I'll try it next year. I've been working in 3 countries for 5 universities in Hong Kong, Ireland, England, and then Taiwan. Also, it's 4 countries. My research, I got my bachelor and master degree here in the College of Public Health. And then I managed to achieve my PhD in University of Washington in Seattle, which is a nice place, but I did not really enjoy that. Anyway, and after the struggling for years out overseas, I came back to Taiwan several years ago. And finally, I've come home. And currently, I work in the global health program and also serve as a associate professor in the Institute of Epidemiology and Preventive Medicine. So, but most of my courses will be given in English here in global health. And I and Andre are in charge with the most fundamental and maybe challenging for some of the students, which is the principles in biostatistics and epidemiology. And we've been trying pretty hard to make it less challenging, but still make perfect sense in epidemiology and biostatistics. So you will see how it works this year. And also, Andrea and me also cooperate to give the lecture about advanced quantitative research methods in the 2nd semester. Okay, so you will see me and Andrea for a lot of time. But don't worry too much. Though it's challenging, but we are willing to help. And also the TA are here to help too. And come to ask for help anytime. And we'll try our best to help you out from the struggling thing. And my research is about mental health. And I've been working in the field about how to apply artificial intelligence to the epidemiological study, especially in the field of mental health for the prevention of premature death and also the physical consequences of severe mental illness. So basically, we were applying the artificial intelligence, or so-called the natural language processing, to subtract the information from the open text fields, or just like a robots to dig out the diamonds, or something meaningful in terms of the consequence of the mental illness. And after coming back to Taiwan, my research focus changed to the application of Taiwan Biobank to the researches about neurological diseases and focusing on the chronic pain. And as a member of the tiering committee of the biobank, I will try to involve more to not only about the management of Taiwan Biobank, but also try to expand the field of the application of biobank rather than just using the genetic database for a lot of repeating research. So I'm trying to expand the network of Taiwan Biobank for further application. So that's pretty good. Okay, thank you.
Thank you very much, Dr. Zhang. And then we'll move on to Dr. Li Wanzhen.
Hello everyone. Because Dr. Wang Zhenli cannot attend today's orientation, but she has a recorded video for you, and I will share her video now.
Thank you, Tom.
Hello, everyone. My name is Wanchen Li. I'm currently an assistant professor in the Institute of Environmental and Occupational Health Sciences, as well as the associate director in the Global Health Program. And just to give you a very brief intro of my educational background, I was an undergrad student in the Department of Public Health at NTU, and then a master's student in environmental health here. Then I received my doctoral degree as Harvard School of Public Health, majoring in environmental health with a minor in occupational health sciences. My research interests are in exposure science, especially on air pollution and health. They can be divided into two tracks. The first track is experiment-based, where I focus on the investigation of kitchen hood performance in reducing cooking emissions. So let me give you some idea about the motivation behind this project. So in Taiwanese studies, it was found that lung cancer risk has been associated with increased number of meals cooked per day for non-smoking women. And the risk was also higher without the use of kitchen exhaust hoods. This is because kitchen emissions, cooking emissions are known to cause various health effects. To reduce the cooking-related air pollutant concentrations, the use of kitchen hoods can be an effective intervention strategy. In Taiwan, the sale of domestic kitchen hood has been increasing with the prevalence of hood installation over 90%. However, there is very few studies in assessing kitchen hood in Taiwanese homes before. Therefore, we have been highly motivated to establish a research framework that allows us to systematically examine the performance of the kitchen hoods commonly used in Taiwan. We hope to eventually provide guidelines on how to select a proper kitchen hood for the homes. So in the past 5 years, we have devoted ourselves to achieving this goal through 3 continuous multi-year projects funded by the Ministry of Science and Technology. In the first 1.5-year kitchen hood study, we set up a testing system in the laboratory so we can characterize the performances of common kitchen hoods that we can find in the Taiwanese market under controlled condition. We surveyed the hood market and selected 27 hoods for testing. We're now still finishing up the performance tests for all the kitchen hoods. After that, we had the other 1-year study. We tested our hood performance hypotheses in an occupied home under real-life situations, so we can understand the hood impacts on indoor air quality and exposure, as well as comparing the findings to those from the laboratory tests. This study included 2 seasons, 2 kitchen hood, pollutant measurements in the kitchen, living room, bedroom, and balcony, as you can see in this figure. We measure particles, NO2, more than 40 kinds of volatile organic compounds, and more than 20 types of trace metals, which is quite a lot. And as you can see in this figure, this is how we place the sampling devices in the kitchen and also in the living room. Last but not least, we also are developing methods in computerized fluid dynamic simulation to visualize the food performance. Another track of my research development is in environmental data analysis. It is a collaborative research project among Taiwan, US, and Brazil with the other two assistant professors. In this project, we're exploring the causal effect of wildfire exposure on the educational performance across schools in Brazil between the years 2009 and 2012. We take into account both spatial and temporal dependence between schools' educational performance and exposure profiles to wildfires, so we can estimate relevant causal effects. Our project will additionally explore how the causal effect of wildfire on education in Brazil has changed over time, and extend the results beyond the scope of Brazil as a country to other countries, including the US, India, and Taiwan. So far, I have one new doctoral student working on this topic. And regarding teaching, I'm the main instructor for 3 English courses. The first one is Essentials of Global Health. This is an undergrad course, and we have GHP students as TAs. The second one is Essentials and Practice of Exposure Assessment, which is what you are seeing now in the video. And I personally highly recommend you take this course. This course integrates both concepts and hands-on practices in environmental health studies, and it is designed into 3 learning stages. In the first learning stage, you will be introduced to the purposes and processes of conducting environmental exposure assessment, including the use of available sampling tools to gather data for exposure monitoring. In the second part, special topics in water and air quality are used as case studies, along with hands-on experiments to analyze collected environmental samples. You will also learn to conduct data analysis and interpret the results. Building on the previous 2 stages, the third part of the course, we will carry out exposure assessment in a field case study. In the past, we did it in the indigenous tribe in the Nantou central part of Taiwan. And then after the trip, students will present the findings. So this is the end of my brief introduction, and I hope you enjoyed it. Also, I'm very much looking forward to seeing you in Taiwan.
Thank you very much, Tom and Dr. Lee, even though she's not here. And then the next we'll move on to Dr. Andre. And Andre, you will have to teach us how to pronounce your last name, because that is one daunting task.
Hello, everyone. Yes, I think my last name is a bit long, so it's kind of Ahmedjanov. But if you cannot pronounce, then you can say just Anyake, my Chinese name. So I'm going to share just 2 slides. I hope you can see. So it's me. And actually, I have a Russian background. And I left Russia actually about 10 years ago. So please don't ask me about what is going on in Russia right now. I'm not really expert in this field. But last maybe 6 years, actually, I was around 2 countries, mainly Taiwan and also Japan. And about a year ago, I moved from Japan to Taiwan, and now I'm an assistant professor at this program and also at the Institute of Epidemiology and Preventive Medicine. And as you could sense from Chinko Sensei presentation, I teach biostats and epidemiology with him. And I should say that we are the kindest faculty in this program, so you can always ask and we are always kind. But our course is a bit maybe challenging for some of you. But I think we'll do our best to deliver some basics of statistics and epidemiology. And regarding my research, actually, as you could also hear, I mainly work on infectious disease and mathematical modeling. And I really like to do outbreak investigation. And it's mainly when the outbreak happens and then we have a cluster of new cases and we try to look what was the reason and to analyze and to look who infected whom and try to reconstruct the transmission tree. So in that case, we try to help people and to understand better what is going on. And recently, we mainly work on coronavirus, but I also work on different infectious disease with my colleagues and as by myself. And in my work, mainly I focus on data analysis and modeling, as I said, and it's mainly based on Bayesian approach, which become a bit popular recently, and also on investigating like dynamic systems. But I should say that my philosophy is mainly to use publicly available data. So it's when you can try to be like a epidemiological detective and to look and to try to find some data that can be helpful for you. So it's kind of like forensic maybe approach. And I really like to do real-time analysis. So it means that when the outbreak happens, then you don't wait until it's over, but you try to predict in the real time. So you don't know actually the outcome. And then actually you can sometimes you can check. And if you're good in guessing or in predictions, then you would become happy. If you're not so good, maybe you would become less happy. But I like this kind of exercise, and actually, I think some of you might understand this challenging aspects. And in my work, I want actually to focus mainly on situation in Asian region. So mainly, I hope I will work mainly on topics in Taiwan and also in neighboring countries. Why? Because sometimes if I do some research for unrelated countries, then it could be a bit questionable practice. But for Taiwan, I think we can communicate, for example, with a governmental organization like CDC, but also we can really see the outcome of our work. So this is me, and if you have any questions, please write me email, or you can just walk to my office and ask. For my email, if you want to write, so it's my surname, this 11 letters, and then you can write gmail.com, and I will try to respond. So thank you very much, and welcome to Taiwan soon, I hope. And I hope to see you very soon, first online, but then in person. 谢谢.
Thank you, Dr. Andre. And next up is Dr. Bohan, and he will also talk about the INDI program that Dr. Lin mentioned in the overview of the program.
Okay. Thank you, Rita. Hello, everyone. I didn't prepare slides, so I'm gonna just talk. So my name is Pohan Lee. I'm currently an assistant professor at Global Health Program, as well as the Institute of Health Policy and Management in National Taiwan University. Before joining National Taiwan University, I was teaching sociology, criminology, and gender studies at the University of Sussex in the UK. So I had a quite different trajectory because I wasn't trained in public health at all before. I was trained in international law with a particular focus on human rights, especially the right to health and the right to health equity. And I'm now also serving as a member, editorial member on the board for an academic journal, Feminist Review. So you can probably already sense that I have quite wide research interest. So basically my research ranges from global health politics, the sociology of knowledge, to social and cultural determinants of health. And I normally has a particular focus on sexual and gender minorities, including their rights and their health advocacy, and how to approach these topics from a perspective of political sociology or human rights law. At the Global Health Program, I'm involved in many courses, so you will have to see me quite often. Mainly in this semester, I co-teach Global Health Law and Ethics with Professor Mingrui Ye, who is not here, and he's from HPM Institute. So we will co-teach the course on Global Health Law and Ethics. And on the other hand, I'm also co-teaching with Professor Yawen Zheng, who's also from the HPM Institute, as well as Professor Rita, who's the coordinator of the event today, regarding the course on globalization and social determinants of health. These two courses will be interesting, trust me. So please feel free to select them and to take a look how we approach health topics from different perspectives. And most of the courses that I convened are in the spring semester, including cultural competence in global health, which will happen in the winter break and will include a first-hand field trip at indigenous communities in Hualien, which is in the eastern part of Taiwan. And then I also convened the course of evidence-based global health policies, one of the compulsory courses as mentioned by Professor Raymond Guo before. And also I convened the course of applied qualitative research methods in global health. Okay, it's a long title, so I sometimes even confuse myself. I'm also part of the teaching team for the course on health research methods, which is coordinated by Director Lin. In addition, at the HPM Institute, I'm also teaching the courses on health and human rights and the sociology of health. However, they are taught in Mandarin. But if any of you who can study in Chinese, then you are totally welcome to join us. Last but not least, as mentioned by Rita and Director Lim, I'm also coordinating the Inclusion, Diversity, and Equality Initiative. Here we call it INDI Initiative, which is based at our program, but we also get a lot of support and endorsement from the College of Public Health. So our new faculty member, Professor Rita Zhang, has been willing to get on board of this initiative lately since she joined us. And as Director Lin mentioned, this initiative was originally advocated and launched by students who witnessed the Black Lives Matter movement in the US and wanted to do something while studying in Taiwan back in 2019. So we try to keep this spirit. So the indie events are still mainly based upon the applications from the students these activities are facilitated through a bottom-up approach. So of course, all students are welcome to take part or even propose new activities because we all know social movements change very fast. And also the world also changes very fast. So we know that students always bring up new ideas and also new targets for advocacy. So for example, our students have participated in the Taipei LGBT Pride, the largest Pride event in Asia, and multiple events in relation to labor's rights, in workers' rights or student rights activism in Taiwan. Also, students have arranged some workshops or seminars on the health and equality of migrant workers in Taiwan, and also on the topics related to the living experience and learning environment for international students just like you. So in addition to these activities, we also have some more relaxing ones. For example, we also had an intercultural holiday party last year in December. So actually we do have quite a balance between like serious topics, but also some relaxing moments. So we will start planning very soon to call on a meeting to welcome anyone among you who may be interested in shaping the indie agenda for this coming academic year. Okay, I think that's all from me.
Thank you, Dr. Lee. And then we'll move on to Dr. Guan Chenyi.
Hi, everyone, and welcome to this GHP program. And I'm Chen Yi Guan, and I am a faculty in GHP program and also in Health Behavior and Community Science Graduate Institute. So for training, I got my PhD in anthropology, and I also got my master training in welfare and public health. So that means I'm a medical anthropologist by training. So in terms of this, my main mission in the School of Public Health is to understand people's experience in terms of healthcare and also people's decision making in terms of how they seek care or whether what they encounter as a challenge in terms of access to healthcare, and then what are the contexts behind. So this is my main mission and my main role in terms of working with public health. And then, for example, I used to do research about the prevalence cesarean section in Taiwan. And then I look at how the decision making of the overuse of C-section, particularly those medically unnecessary, how those decisions were made in a specific social cultural context, interacting with the very specific healthcare system developed in a very specific historical context. Okay, so that was my previous research. And nowadays, I shift my research interest to vaccine hesitancy. So that is an important issue, in particularly in this COVID-19 pandemic. So nowadays, I also lead a team to conduct rapid ethnographic research on people's decision-making and concerns about whether to uptake the COVID-19 vaccine. So that's what I do for now. And so you can kind of see my research interest is also quite broad. So my main interests include medical anthropology and also in gender and in medicalized childbirth and also in culture and healthcare and also in lay interpretation of risk. So and also in vaccine hesitancy, so all in that. So for the teaching, I in GHB course, I teach with Dr. Susan Zhang in the social and behavioral foundations of health and healthcare. And I particularly talk about the section about gender and health. And besides this course in GHP, I also teach qualitative method in public health and also gender in and health, but in Mandarin. But as Dr. Bohan says, you are all welcome to join if you kind of interested in learn something in sort of if you want to learn Mandarin and sit in a course, you are of course welcomed. And the end is that my office in the 6th floor. So if you have any opportunity, you are welcome to stop by.
Thank you, Dr. Guan. I hear echo of myself. Then I will give the stage to Dr. Yang Ruiyu. Dr. Yang, you have to turn on your mic.
You have to unmute.
Yes. Okay. Can you hear me well?
Yes.
Hello, everybody. I thought I will be the next after you, Rita. So I still have a
Yeah, sorry,
camera
because
on.
I was hearing echo on my own part, so I'm like trying to figure out what's going on. But if
Okay,
you want to
great.
go after me, that's okay as well. Because now I
Okay,
don't hear
good.
echo.
Good. I'm ready. So that's I also didn't
so
prepare any any slide. So, but I kind of pick up my very brief CV, so you will know me. First, welcome all, and then I don't know if all of you are in Taiwan already or not yet, but welcome. I mean, this semester. So, let me share my okay. So my name is Ray Young. I'm at NTU is adjunct associate professor at the Global Health Program. I only provide a two credit course. I will introduce later a bit. Currently, I'm working for as a food system and nutrition specialist for Food and Fertilizer Technology Center for the Asian and Pacific region. So it's more networking kind of a center. So we are more working on an international conference and networking and not really in the research. Okay, so maybe I will mention a bit my past experience. Because I just joined the center joined NTU last year. So before that, I worked for the World Vegetable Center. It is an international organization. It's an interdisciplinary. Basically, it's more focused on agriculture, but also linked with nutrition and the health to address the malnutrition and also the poverty. Okay, so over the past 15 years, I worked for the, actually it's more than 20 years, I worked for a World Vegetable Center. And then my major work is, I lead a laboratory, so I characterized more than 250 types of vegetables. Most are from tropical Asia and Africa. And then I work for, measure their phytonutrients content and nutrient contents. And I also work with breeders to improve the nutrition and market quality of different kinds of vegetables, including tomato, pepper, eggplant, soybean vegetables, and pumpkin beetle gourd, different kind of variety, and several kind of underutilized crops. We can also say the indigenous vegetables. And actually, my past experience, most are work with, interdisciplinary. So I collaborate with agricultural, socioeconomic, and health scientists on the projects or programs, emphasizing the nutrition sensitive and evidence-based interventions to alleviate the double burdens and malnutrition. Okay. Most are our project size in the lower income countries. So for working for the project, we develop strategy, a framework, and also design the interventions. And we also need to validate the interventions in the field. Okay. For me, I use more the method in terms of the KAP to measure the outcomes and also the impact, the knowledge and attitude and practice to measure outcomes in a shorter term, and then the longer term is the impact. Okay. So I think it's enough. So last year, I left World Vegetable Center last year, and I joined FFTC. It's a Food and Fertilizer Technology Center. As I just mentioned, it's international networking and workshop conference center. Basically, we're more focused on and fostering the information exchange and the network in Asian Pacific regions. Okay, so so I give an example of the projects like I've been mentioned in the course. It's that was just finished 2 years ago when I worked for World Vegetable Center. We try to address the gardening work in different countries, how the vegetable garden can address the double burdens. And we know that a gardening work in the more higher income countries actually is more related to the behavior and healthy diets. But then how this gardening work can address in the lower income countries, because the background and also context are totally different, particularly is related to food security and also availability and utilizations of the festivals, of the food. So how that we can develop a program to address the different context, still that we can at the same time address the same directions in terms of healthy diets, also in terms of the improved nutrition. That it's basically how we work. Then I would like to also mention a bit the course that I'm taught last semester. So probably I will have one in the next semester, not this one, but the next semester. So that course, maybe I'll share with you that course. Screen one, share. Okay, did I share already? No, not yet.
Yes, I think it's coming up.
It's coming up. Okay, good. So I just like to mention about the course. Still now I kind of modified it a bit, but it's a course we let's see. Okay, it's global nutrition, improve the nutrition through multi-sectoral approaches. And last year is the part 1 and part 2 in 2 semesters. And then this year we want to combine into more dense type of, and we probably also will invite some faculties from the public health and also global health programs to join the course. So maybe I make it bigger. So this course is basically designed for students to become familiar with the global nutrition related topics, behaviors and practices and attitudes needed in their future career paths. And so this course will provide a platform for students to learn and apply and demonstrate their knowledge and skills. So you learn many theory things, and maybe we can, this course maybe can kind of integrate all this knowledge and also the skills, then try to develop some strategy, particularly that for targeting on the malnutrition problems in the developing countries. This course will have 5 major sections. So first one, I provide an overview of international nutrition. And second one is about poverty, food and nutrition security, and also the healthy food systems. So it's kind of give you an overview of these food system related that can be economic, that are social, from nutrition and health. All these sectors are linked. And number 3, it's more the nutrition sensitive and specific interventions. So when we talk about nutrition specific, I think it's more straightforward, clear, maybe for you in this area. But nutrition sensitive, what's that? That could be an agriculture type of intervention. That could be a social type of intervention, but with a very clear nutrition objective there through the other kind of disciplinary intervention, but you can also achieve for nutrition. So that kind of program, how we can work together and can develop programs, work disciplinary and to achieve the nutrition goal. And very important that what type of interventions that we can design for the project. And another important one is you definitely need to know that the program you develop, it works or not working. So monitoring, evaluation, and also adaptive learning is very important. And how we can build in the monitoring evaluation, this part into the project, and eventually that we can measure their outcomes and tell that if the program and intervention work or not. Okay, and then part of that, I also will introduce the international organizations, the donors and grants. So you kind of have some idea about in terms of international project, aiming at malnutrition problems, what is the environments in terms of donors and also the networking and partners to work with. So I think my introductions will be here. I will stop sharing. Okay, so that will be next semester. So you're welcome to. Okay.
Thank you again, Dr. Yang. And I will share my, see if I can make it work. Okay, so I don't have slides, but I can show you my website. Can you all see it? Can you see this? Can you see the website coming up? Okay.
Yes, we can. Yes.
Okay, thank you. So I am one of the newest addition to the program, and my background, like Peter and Peter Lee and Dr. Guan, is not in public health. My PhD is in communication studies. So part of my research is health communication, and I have done a variety of things that are not very academic related. So if you're interested, you can come to my website and you can see the academic and teaching and service and other stuff that I do. In global health program, I will be, in this semester, I'll be co-teaching 4 courses that have already been introduced. So I'm not gonna go into the details, but I will be lecturing a couple courses in these lessons, and I'm very excited about that. And in terms of my background, like I said, I graduated from University of Texas, Austin, communication studies. So I graduated in 2019, and I joined global health program this semester. And in between, I joined Green Party Taiwan, and I ran for the parliament, and I did more of advocacy work, policy work. So I have a little bit background there, and I spend a lot of my time doing social movements, especially LGBTQ social movements. So I would say a lot of my experiences is in the frontline advocacy and social movement, and I'm hoping to bring that into my teaching and research. In terms of research, in the past, my research is mostly family communication and health communication, and I'm hoping to expand my research into, so move on to this part. I'm hoping to do, hoping to understand low birth rate and also infodemics and human relationship. Infodemic is the new term coined by WHO to talk about, to describe the situation now we're in, where information about disease and pandemics is just exploding, and people are bombarded by real and not so real fake information, and it's just very difficult to parse out and then to decide what to do. So just an overview of that. And then if you are interested in the INDIE program that Dr. Bohan Lee talked about, you can go to, oh, I don't have the website linked here, but this is the INDIE, Inclusion, Diversity, and Equality Initiative. And this is a program that's housed in global health. And just like Peter said, it was initiated by students, and these has been what the students have been doing. So if you're interested in initiating anything, you feel free to apply for INDIE funding. It might be a little bit difficult if you're not here in Taiwan, but I'm sure you can think of some creative ways to engage with the community even online. So that is that. And I will, because of time, I will turn the time to Dr. Jenny Xie, and I will stop. Dr. Xie, the stage is yours.
Can you unmute, Jenny?
Oh, sorry. Now is it? Can you hear me?
Yes.
Yeah. Sorry. Let me share my slide. Can you see my screen now?
Yes.
Okay. So hi everyone, and I'm just going to. My name is Jenny, and I'm going to talk a little about myself. So my current positions. I'm sorry, I'm seeing here because I have 2 screens. So my current position is adjunct instructor at NTU. So I teach a course in the spring semester, which is called Introduction to Data Processing in Global Health Practice. So I'll talk a little bit more later. But my main position is I'm working as a consultant at PAHO WHO. So PAHO is the regional office of WHO in the Americas. So I was based in Washington, D.C. in the US, but currently I live in Taiwan. So a large part of my work involves data collection, database management, and data visualizations. So this is what I do in WHO. And I'm working on 2 main projects, but also many others. So it's the antimicrobial resistance surveillance in the Americas, including the whole American region. And I'm also helping with the point prevalence surveys on antibiotics used in Latin America and the Caribbean. So basically learning about their antibiotic use in hospitals in our region. So I've been to different Latin American countries and Caribbean countries, going to the field to support their data collection. And I did the training workshop for the local data collectors in terms of data collection. And I'm also supporting PAHO in terms of data cleaning, data transformation, and database management. So as you can see, a large part of my work involves data. A little about my educational background. I graduated from NTU. And then I did my master's degree at University of Oxford. I got a master in international health and tropical medicine. My previous working experience in mostly in resource limited settings. So after graduating from NTU, I worked in Malawi with Look International. I believe is one of your placement organization. So I work on mHealth projects, basically using mobile phones to help with data collections. And then I also works on clinical trials and health information systems building in Malawi. And then before the course in NTU, I also teach in Oxford before the pandemic. I teach the same course, data processing in Oxford. And yeah, and I talk about my current position with PAHO. So I'm going to talk about what my course involves. So basically, when you deal with data, this is the process. So first, you have the data collection. Either you collect yourself or you already have a database for you to do the analysis. But before the analysis, there's a big step. You have to do data cleaning because not all the data are ready for you to do the analysis. It may be messy or it may be very big that you don't know what involved. So you have to do some data cleaning, data exploring before the analysis. And then we have the analysis process, which you use different tools to do the analysis. And finally, is the report of your results. So what my course focusing on is the first 2 stages. So rather than analysis and report, I focus on how to collect data. So I'll teach a tool. I'll teach you how to use electronic data capture method to collect your data. So nowadays we don't use paper-based method anymore. I'm going to teach you a tool called RedCap. So this is a tool that has been widely used over the world in academic or other fields. And it supports all types of data collection, like cross-sectional study, cohort study, clinical trials, like different, and it's free. So I'm going to teach you how to use this tool to do your data collection. And also, not only talking about the tools, but I'm going to talk about the principles of designing data collection instrument, because we know that good quality of data produce good quality of results. So this is very important that you have to design your instruments in a way that helps you to ensure your data quality. And then the second part of my course talk about data cleaning. I'm going to use R. So you'll have a lot of time during my course to practice using RedCap and R to do collection and data cleaning. So I'm talking about how to export your raw data, how to use R to tidy up your data. We will introduce you a few packages in R that allows you to tidy up your data and prepare your data for analysis. So this is my course. Is a 6-week intensive course, a 1 credit in spring semesters. So as you can see, the first 2 weeks we focus on data collection and management in RedCap. The week between week 3 to 5, we talk about data processing in R, using R. And then the last week, I'm going to talk a little about data visualization, but I'm not going to go into deep about how to do data visualization, but rather than introduce you to different kind of tools that you can use. And also talk about the principles in designing data collection. So that's the my introduction. Thank you.
Thank you very much, Dr. Xie. And then the last up will be Dr. Lin Xinqing.
Hi, can everybody hear me?
Yes, but I think, Dr. Xie, you have to stop sharing your screen first.
Let me, okay, now
Yeah,
it's,
that's good. Yeah, that's good now.
Give me 1 second. For some reasons, my computer doesn't allow me to share my screen, so I will just talk. So hi, everybody. Welcome. Welcome to the program. My name is Claire Lin. I go by Claire. I'm not officially affiliated with the GHP program, but I'm a faculty member in the College of Public Health, Institute of Health Policy and Management. So welcome. My background is public health. I did my bachelor degree in public health and economics from National Taiwan University. I did my master program in Johns Hopkins University, Baltimore, Maryland, United States, and then PhD in University of North Carolina, Chapel Hill, USA. If anybody is from North Carolina, let me know. We should chat. I had a variety of interests. My background mainly is health economics, very quantitative heavy based. But I'm also interested in a lot of topics like health disparity, telehealth. I'm mostly interested in vulnerable populations. So the minority, those without a lot of medical resources, those people in rural areas. These are all my research topics. So if you're, and also maternal health, I think women's health is important and maternal health as well. So if you're interested in any of these, come talk to me. I have an open door policy. Anytime, just come knock my door. It's probably open. Okay, the highlight. I am having a new course in GHP program this year, this semester, the coming semester, in 1 week. So the new course is health. We call it Principles of Health Economics. It sounds scary, but it's not. It's very interesting. Promise. I can share my slide here. So go on the website, look for the course. I have the weekly schedule outlined. We have a lot of interesting topics. How are human beings producing their health? Yeah, you produce your health. You do healthy things. You eat healthy food to produce health, which is very, very interesting. And how, as a community, we produce community health. How are the providers making decisions? do prices matter? Do they care about the price or not? Do they just prescribe whatever they like, or do they just listen to you and prescribe whatever you like? These are all interesting topics. We talk about incentives. We will have a lot of special topics in different sectors. So come join us. We have homework, we have midterm, we have finals. Sounds very scary, but it's fun, I promise. Also, we have 3 invited presentations at least. These are people with real world experiences in program evaluation, in long-term care, nursing home sector. Also, someone also from like pharmaceutical cost benefit evaluation type of work. So anyway, all I want to say is it's fun. Come join us. And I will be very happy to talk to any of you if you, even I'm not officially affiliated with the program, but open door policy, always come by and welcome. Thank you.
Thank you very much, Dr. Lin. And that concludes the section where all the professors in the program and also will be teaching courses for the program have introduced their research in their own courses. So I will hand the stage, I'll give the stage to the students. And we're sorry we take a little bit of time of yours, but I think, I'm not sure who will be hosting this stage. Tom, do you know?
I think maybe Yangshan or Elizabeth. Maybe one of you can
Okay.
take the lead.
Hi.
Hello, Yangshan.
So
I'm
who will do this?
Elizabeth. I
Hello,
think that
Elizabeth.
we're starting with the Kahoot, which I think Yangshan is doing, right? Yeah. Okay.
Faculty, you feel free to stay, but feel free to leave if you have other commitments. But if you stay, you need to play the Kahoot. Or do
Does
we?
that suggest we'd better leave?
You guys would win the Kahoot too easily. So do us
Yeah, Elizabeth, I'm afraid I cannot
So
go with
we're
you
starting with
for
the
Oh.
yeah, but I'd like to
Stephanie
mention that
is
it probably would be good if you current students can share with your experiences in terms of having online course, because currently we have received a notification from the campus that for the at least the first 2 weeks of the course be online. So please remind the students about preparing their devices, cameras, microphones, and the software is really important. Thank you.
Thank you for a reminder.
thank you, Professor. Yeah, so as a practice, I think we're going to request students to open their cameras for this Kahoot game. Okay, and Stephanie is going to host the Kahoot game, okay? Stephanie?
Steph, I think you're muted.
I was having microphone problems. I was, but I couldn't anyway, it doesn't matter. Hi, everyone. Yeah, you can go ahead and type in, you can do it through your phone or your laptop, but you can just go to kahoot.it and then type in the game pin.
Maybe while they're doing that, we can all say who we are so they know
Yeah, go
which
ahead.
ones of us are current students. I can start. My name is Elizabeth Gilmore. Hello. I am what are the things we said we were gonna do? I'm from LA. I also grew up in Beijing, and then my undergrad is USC, USC Southern California, not South Carolina, which I recently learned I need to specify. Cue for Jessica to go.
Yes. Okay. Yeah. So my name's Jessica. I am originally from the United States as well. and I'm from South Carolina. For my undergrad, I was at Duke, where I also studied global health and Asian Middle Eastern studies. And really excited to get to know all of you guys better this semester.
Okay, so hi everyone. I am Youngsun, and I am from the Philippines. Well, I think that's it. I graduated from the University of the Philippines and decided to go here. So, yeah. Steph?
Yes. Hi, everyone. I'm Stephanie. My background is in nursing, but my bachelor's is in public health, and I finished at Northern Illinois University. And I'm originally from Colombia, but I've lived most of my life in the US. Okay. 1, 2, 3, 10. We have only 10. Did everyone who wants to participate, are you all logged in, or should we give you all maybe 1 more minute, since there seems to be people still logging in? Okay. Okay. All right, maybe we can go ahead and start, since we are pressed with time. So I'll move this around. Here we go. Okay, so welcome to the GHP Orientation, and we can start. So how well do you know Taiwan? Let's find out. Who is the current president of Taiwan? You can go ahead and choose a picture.
You get more points for going at like the fastest. So just so people know if you want to win.
Yes, correct. That is correct. The other people presented here, they are also politicians. And at some point, one of them was there before the current president, but they're all pretty much politicians here in Taiwan. So great job, Claire. And the second question, as of September 9th, how many total cases of COVID-19 were confirmed in Taiwan?
Wow.
And this is according to the CDC in Taiwan. Okay. So that is correct. There are about 16,062 cases, total cases, confirmed cases in Taiwan. Okay. How many indigenous peoples groups are officially recognized in Taiwan? Okay, looks like everyone answered, so we can go ahead and see the answer. And it is 13, correct. Okay, and we'll move on to the next question. What is this in being pictured right here? It is very famous in Taiwan. Depends who you ask. They may say it's very, very delicious, very smelly, there's very different words to describe this. But it's correct, it's chou tofu, or as it's popularly known as stinky tofu.
Yes.
It's very popular, and you definitely have to try it. Okay, and how many students will be in your cohort? This is an incoming cohort. And this is a mixture between master's students and PhD students. Correct, it is 11 master's students and 2 PhD students. And it looks like it was half and half with 16 and 6. Okay. All right, and we'll see. Oh, good job, Jess, 3rd place.
Are you playing, Jess?
She is playing.
I thought they will be for the new cohort.
Awesome. Great job. And then we have the runner-up, Claire, too. Okay, great. This is great, everyone. It seems like everyone has a good understanding of Taiwan and what is expected, but now we can move on to the PowerPoint that we have prepared for all of you. So if you want, I can share it and then we can go from there. Just 1 second. Should be this one again, but.
Thanks, Steph.
It's a little bit slow. So, oh no, that's not what I meant to press. My bad. Bear with me. Okay, 1 second. This is taking a little longer than I expected. Okay. Okay, you should be able to see it. Let me know if you can actually see it.
We
Yes?
can see it.
Okay. Okay, awesome.
All right. So it's loading, but just to give you a little bit of information about what this is just some helpful tips. Some of them were shared with us from previous year's students. And then we thought they were so helpful, we just wanted to pass them on to you. And some of them are things that we added based off of things that we think would have been helpful to know when we first came to Taiwan. And so we're not going to go into everything super in detail, but just a brief overview. And then also we'll tell you maybe who might be someone helpful to contact in the future if you have questions about maybe housing or, you know, a specific thing. But just in terms of daily life, Taiwan is super convenient. Oh goodness, sorry. Cat is messing with me. But Taiwan is very convenient. There are 7-Elevens and convenience stores everywhere, and you can do everything from paying your bills to buying breakfast to ordering a train ticket at a 7-Eleven. So it's really convenient. In Taiwan, there's not really a culture of tipping. But I would recommend if you are ordering off like Uber Eats or something, I would recommend tipping just because these people are working in the gig economy and so they already don't have that many resources. So maybe don't tip in restaurants, but if you do have an opportunity and you have the means, it's nice. Certain things because of the climate will go bad really easily. So things like bread, things like avocado, because it is very hot and humid, make sure to put them in the refrigerator. And then I guess other things. So in terms of the dates, they order year, month, and then day. And oftentimes, or not oftentimes, but occasionally, so for example, if you're at the bank, they may use a different year calendar compared to what we're used to. So you can see here in the middle in the teal, there's an ROC era. So that's the Mingguo calendar compared to like the Gregorian calendar years. And so that is really not that complicated. You can just do a quick Google search to convert the years. But I've only had a couple instances when I've had to do that. Emergency numbers, it's good to know that the police is 110. Thankfully, I've never had to use either of these, but the police is 110, and then the fire or ambulance would be 119. And then in terms of natural events, there are earthquakes here, there are typhoons. I know all of us who have been here, even just for 1 year, have experienced both of those. But the government will send you a text message if it is close to you or if there is a need to do anything for your safety. And moving on to Steph, we'll share some stuff about the quarantine tips.
Yes. So in terms of quarantine, this is where you will be arriving to as soon as you enter Taiwan. So you'll go directly from the airport right into your quarantine hotel. Quarantine, if maybe some of you have experienced quarantine before, like staying in a specialized facility or in a hotel, but it can take a toll on your mental health. It depends on how you're coping with the situation. So since we've all had to experience that here, some of the best ways that we could care for our mental health during this quarantine time is to come prepared with different activities, or maybe start a new hobby. A lot of people brought like puzzles or different books to read, at-home workouts, or even just calling home, calling a friend, calling family to kind of just keep saying during those 2 weeks that you have. So yeah, just staying involved and staying active. It depends on also when you're arriving. So classes might start by then. So you would also have that sense of a sense of habit forming throughout the day there, that you go to class and then you have other activities to compensate for that. And also feel free to bring things that make you feel comfortable while you're in the quarantine hotel, even if it's not necessarily practical, but if there's something that's within your comfort zone that will make you sustain these 2 weeks, don't hesitate to bring that along. You will be provided all 3 meals during your quarantine stay. However, you are free to order from Uber Eats or Food Panda. Word of caution though, just be mindful that there are certain times that you're able to order from these delivery places. So you might want to check with your hotel, when is that cutoff time? I know a couple of us tried ordering things late at night and the hotel they either didn't have the staff, or because of policy, they just couldn't bring it up to our rooms until the next day. So make sure to ask about that. And you might want to bring some students brought detergent with them. Sometimes you spill things accidentally and you have to clean it up, or you might want to wash your clothes because you don't want to necessarily unpack everything from your larger suitcase. And with that being said, you might want to bring some small toiletries like shampoo, conditioners, toothpaste. Although the hotel does provide you with some of those things, after you finish your quarantine stay, you will be going into the place where you will be staying, whether that's the dormitories or off-campus housing. And I don't know how everyone feels about this, but I was just tired, and you have to figure out, like you have to do grocery shopping or buying things that you might need for the day. So just having like a small set of toiletries with you so that you can at least have that one day to go back and kind of debrief and relax. It really helped a lot. And snacks from home. So this was just nice during the 2 weeks to have something familiar with you, so that sometimes you get homesick or you just want a snack that you are used to, or even when after quarantine, you can have some snacks to eat. And when you are leaving the hotel, it is recommended that you either use Uber to go back to your place where you will be staying, or ask the hotel to call a taxi. It tends to be the most economic way to get around from the quarantine hotel to wherever else you will be staying. With that said, does anybody else, in terms of like my cohort, my colleagues, want to add anything, or? Okay, if not, then I can go ahead and move on to the next slide. Okay.
Okay, thank you, Steph. So now we're moving on to settling in, where to live in NTU, where to live off campus and everything. So we put some of the names of the people here in our PowerPoint. So for off campus, you can talk to Elizabeth. So Elizabeth currently lives near Shimin. So if you want to have off campus housing, you can definitely talk to Elizabeth. Then for coaching, so yeah, the three of us, Jessica, Stephanie, and me, currently lives in Koching. So basically, I think some of the people from the new cohort is also going to live in Koching. So you can just ask about us. And for your problems like mattress and like where to buy stuff, actually many of the stuff you can use are already in the convenience store below our dorm. So there's a High Life below Goching, and many of the mattress, also a pillow, is already there. So for the first day you can just use that. The mattress is actually a little thin, so if you really want to have like a thicker mattress, I suggest you can buy it from IKEA or from Carrefour or anywhere else, because usually the mattress sold in the convenience store or other department store are a little thin. And for Prince House or the BOT dorms, you can ask Brianna. I'm not sure if Brianna is here. Is Brianna here? Anyway, uh, you can ask Brianna. So Brianna is also part of our cohort. So after your quarantine, the first thing you need to do is to set up your ARC. So you can just go to the website of the immigration office, fill out everything you need to do there, and then send all the required documents. Then after that, you can go to the immigration office at Shaonan, and then you can just get your ARC card. So I think if it will only take for around 2 weeks for you to get the ARC card from the time you registered it from the internet. So yeah, you also need to submit passport photos in the office. So there are kiosks available at the basement of immigration office. And for those who are living in campus, there are also one photo kiosk inside Gongguan Station. So that's the station near NTU main campus. So for health check, I think OIA will discuss it more because since the regulations are different this year compared to last year, we're not really sure like the whole and complete information about it. So you can ask OIA about it. There will be 7 days self-help management. So after you got out of the quarantine in the hotel for 14 days, you have to monitor your health for 7 days. But I think you can already go out and like buy food, but you cannot just like go in uh, places where there are like many people. Next slide. Okay, then so many of the students are actually asking where to eat and like how to go around the campus. So inside the NTU main campus, there are actually a lot of cafeterias. So for those who are going to live in Coaching dormitory, there's the cafeteria beside the main library. So that's the closest cafeteria in our dorm. There's also lane 118, so it's outside the campus. So it's a little pricey because it's restaurants outside the campus, but it's definitely worth a try. And there's also beside the graduate dorm one. So the graduate dorm one cafeteria, I think, is the closest to the Prince dorm, which is going to live in Shreyan campus, because the graduate dorm one is the dorm at the front of the campus, and Goching dormitory is like at the back of the campus. So there's also beside dorm 9. So if you have the NTU map, so there's the Drunken Moon Lake, you can see the dorm 9 there, and there's also a cafeteria there. There's Xiaoshafu Plaza near the general education building. So for those who's going to take Chinese classes, there are like a little cafeteria there where you can buy food. There's also Shafu Plaza. So Shafu Plaza is kind of the most pricey place in NTU campus. So it's basically fast food and restaurants in there. And lastly, of course, the famous Gongguan Night Market in front of NTU campus. So in CPH, so CPH is actually a little far from the main campus. I think it's around 5 kilometers away. So there is a cafeteria near our building. It's cheap. I think it's the cheapest cafeteria among all the cafeterias in the NTU campus. There's also shops near Shandao Temple. So the price range will range from not so pricey to so pricey because it's different stalls. And lastly, the shops under the NTU hospital. So under the NTU hospital, there are like lots of restaurants there, so it's a little pricey too. So lastly, going around NTU campuses. So after you arrive in Taiwan, you will notice that there are two types of bike. So the U-Bike 1.0 and the U-Bike 2.0. So you will identify them through their colors. So the U-Bike 1.0 is orange. If you want to bike outside the campus, like you're going out to Ximen or like any places in Taipei that is outside campus, the 1.01 is much better to use. And the 2.01 is color white and is mainly used inside the campus. So that's it. So also for those who are interested, there are second-hand bikes available in NTU Bike Office, and it is sold for 600 NTD. So usually they only sell the bikes every Thursday. So if you want to have a second-hand bike, you must go at the queue around 6 a.m. for you to have a sure one to get one bike. So lastly, there's also the NTU bus shuttle. So the NTU bus shuttle is kind of important because for those who's going to live inside the main campus, the NTU bus shuttle will take you to CPH. It will not drop you off directly at CPH, but there's a bus station near CPH where it will drop you there. So that's it.
Okay, I have 1 minute and 2 slides, so I'm gonna go as fast as I can. But I'm just gonna probably skim the important things, but we're gonna send you the slides and then our contact information afterwards, so you can always get into it. Because we also go way in detail. There's too much detail to go into. So Yangshan kind of briefly mentioned that there's 2 campuses. So some highlights for the NTU main campus that you'll need to know is basically that's where you would take Chinese classes. So all our other classes are going to be at CPH, except if you take maybe, we had like one elective that was at NTU main campus. Software, maybe you used to need to go to main campus to get that, but now you can do it online. So you can ask us if you need help with that. As he mentioned, there are discounts. So bring your student card with you everywhere. You'll need that anyways for a lot of transportation, which I'll get into. There is a gym, which I don't use. I don't know if any of you guys have ever used the gym membership, but it exists. So if you have questions, let us know. There's a club fair, which I think we missed last year and y'all will probably miss, but it also exists. Oh, it might be online this year actually, right? It probably is online. We can send that also. Okay, and so CPH, so this is where you're going to spend most of your time, especially the first 2 semesters. You can register your ID on the first floor to get into the building after hours. And I don't know if that's still the same right now with COVID, but I'm just going to pretend COVID doesn't exist for the rest of this, but just caveat, there's COVID, so it's different right now. So there's a global lounge downstairs, which is really nice. It has a bunch of like couches and stuff. And so people can kind of go down there and eat your lunch or hang out and do group projects or whatever it is. But you can't leave any trash there or to-go cups. So yeah, side note. There's also a place right next to the global lounge that you can print stuff. You get a semester allowance of a certain amount of money that I don't remember, but you can, it's enough to print the things that you need to print. There's a study room upstairs, which I think a lot of us spend a lot of time in, especially first semester. We've used it to like eat lunch together or to study. The air conditioning stops at 8, which is very important during the hot days. We also have like in the top shelf, there's like coffee cups and coffee, and people just kind of put their like extra utensils and stuff. So that room is just for our program. So it's really nice. It's a nice thing that we have, and we're very thankful. Also, we have to clean it ourselves. So make sure to be mindful of the mess that you make. And then lastly, Yangshan went into a little bit like about food you can find around, but yeah, the med school and the hospital are right, like kind of not really across the street, but like on the corner, like across the corner. And that's where you'll find some of the cafeterias, and you can use your ID to get into the medical school and the hospital, where you can get more food. And there's also, you can study there where the med school is. There's like libraries and a cafe, and then there's some offices that you'll need to go to like do logistical things, and that's over there. And then lastly, but not least, this is where of course we have all our classes, and yeah, it's going to be online. I guess we could give you more tips about taking classes online. Maybe ask your buddy about it, what their experience was, because we all had to do it at some point, except, oh yeah, we all had to do it at some point, yeah. And if you have questions about specific classes, so about like electives or what to expect with workload, please ask someone. And yeah, apps. So plug for our social media, it's there. And then there's messaging. So people usually use messaging apps here. Line is the most popular. People also use Messenger or like Instagram. There's a little line, a picture of Line there. And transportation. Google Maps is going to be the best thing for transportation. It's really, really convenient. It'll show you all the steps and like the fastest way and all the intersections of the types of public transportation. There are some other apps you'll found helpful, specifically Bus Plus is a little bit more accurate in terms of the timings of the buses if you like using the bus. I'm not going to go into all those. Power bank rental, if you can go to convenience stores and use an app to like charge your phone. Translation app, Google Translate and Playco are the best ones. Food delivery, we talked about Uber Eats, Food Panda. Uber Eats is like the same as if you're from the US or somewhere that uses Uber Eats. You don't need to like do anything else. Tourism, I've never used any of those, but people like them. Receipts, lottery, so here in Taiwan, every receipt you get, it's like a lottery entry. And so some people like myself like to use an app to scan all your receipts, and it'll help you automatically know if you like won the lottery or not. It's called Zaiju. So this is the Chinese. You can like copy it and find the app. And when you guys get here, you can ask me and I'll help you with it. Next. Okay, so transportation, there are a lot of types of public transportation and it's really helpful. The bar is low for me personally because I'm from LA, but it's really amazing. The NTU shuttles we talked about, there's MRT, which is subway, public bus, we talked about U-bikes. You can also take taxi and Uber, it's very easy. Google Maps is better. You can call a taxi from any convenience store. You can use an iBond machine, which is like a machine in convenience stores that has a bunch of stuff like printing, buying tickets. You can use it to call a taxi. You can also ask the clerk for help. U-bike, we talked about it a little bit. You use your Yo-Yo card, which is Easy Card, and it's basically your NTU ID, and you register that at a U-bike kiosk before you can start using U-bikes. But that's what you use for MRT for all public transportation. And a random note, buses don't stop at every bus stop. This might not be news to you, but in some places that is normal, but just make sure that you like flag the bus down, and you also have to like press the button in order to get off. So just take initiative to make sure that you don't get lost. Where to live, if you're looking for somewhere to live, people have found Facebook pages, TLIT591, which is only in Chinese, and TMM Rental very useful. There's links at the end of the slide, but you can also ask me and I'll add you to 1 million Facebook groups. And I can also connect you with my landlord, who's very nice. And then, okay, so random things. Banking, there's ATMs at almost every MRT station and convenience stores. They're also randomly around. Most of you will probably get a post office bank account. And there's also like at the post offices, they'll have ATMs. People also like to use Line Pay here. I guess Apple Pay works. I've never used that, and then also you can use your Yo-Yo card, the like Easy Card. You can like load money on it and you can pay with it at convenience stores and a lot of places. But mostly you need to have cash, just so you know. Everyone uses cash. Grocery stores, PXSmart is what most of us use as like the like cheapest normal option. And then all the way to the most like expensive would be Jason's. If you're looking for something international, you need to go there, or maybe like Carrefour, but they're really expensive. Random other stores, Cosmed, Hoya, and Watson's are like health things, like toiletries or like medicines. And then people really like the buy sell Facebook pages. We can add you to those as well. I use that for most of my, like when you move here, it's really helpful for like just like random house stuff that you don't need, like really like dishes and things like that you don't want to bring with you. You could also go to the household stores, would be like Costco, IKEA. That's nice if like if you're comfortable with those, especially when you first move. It's like stressful, you know. But cheaper options would be like Notori is really nice still, but it's cheaper than Costco and IKEA. It's like a Japanese store. And then the cheapest would be general stores, which are, if you find them, they are very easy. So if you guys need help with that, there's one called Senli General Merchandise that's near the dorms, the Guoqing dorms. And then, okay, online shopping. So Amazon Prime works. I haven't really used it. I don't know if y'all have, but it's like not as convenient as in the US, but does work. Shopee is the most convenient once you figure out how to use it. Once you figure out how to use it, it's very dangerous. It's so easy to use. You can just buy everything. It's so cheap. But it's all in Chinese, so you just have to like figure it out. On that note, if you're shipping things, medications, you really need to like look into that because they stop most medications. I've had a lot of like medications not make it to me. So like just make sure that like you look into what the rules are about that, and you might need to just bring it with you beforehand. So like birth control, things like that, like anything that's like a pill or any kind of medication.
Point about pharmacies though is that I've found that you can really get medication very easily. So
Yeah.
medication that in the United States I would need a prescription for, I don't need here. So
that's a good point.
It depends on how specific your medication is, because pharmacies are very easily accessible.
That's a good point. Yeah. So you're not going to have to bring everything. You don't need to like pack everything beforehand, but just know if someone's trying to send you medication, there will be issues. And then you can ship your things to convenience stores. It's very easy. So any convenience store around, you can like have it sent there and you just go pick it up. It's really easy. And then I already talked about the receipts. So now I'm done. So thank you guys for listening to this speedy presentation. These are some links, and then what's the last page, please? These are some pictures of us. I think I can speak for all of us that we've had like a really transformative, fun experience here in Taiwan, and we really hope the same for all of you. So if we can do anything to make your transition easier, we'd really love to do that. So please don't hesitate to reach out. The end.
Okay, any questions?
Can I ask something?
Yeah.
I wanted to ask about kind of phone service, and do you guys get it as soon as you get there, and is it easy to get it, and how do you do it?
So when you come into Taiwan, you will get a temporary phone card at the airport because you have to have access to the internet for your quarantine, because you're going to get texts from the government, you're going to get, you have to use Line. So I would recommend getting a 1-month phone card when you're in the airport. And then, so that will give you enough for your 2 weeks of quarantine as well as your 1 week of self-help management. And then after that, it's really up to you. I got a 2-year student plan at Changhua Telecom, which is, I think, it's pretty affordable for me. It was around 400 NTD, 450 NTD a month. But I know like Steph got a different kind of plan. But at least for that first month, you'll be covered by your phone plan that you buy in the airport.
Yeah, as just mentioned, I got the prepaid plan. So I was not planning on staying the full 2 years, so I knew that the 2-year plan wouldn't work for me. And the prepaid plan, you pay every 6 months. You get to keep the same phone number, which is great, but you get to choose. I mean, you could, if you choose, you could pay for it for less than 6 months. But I guess it doesn't really make sense if you're going to be here at least that certain amount of time. But I get like unlimited internet usage and I think like a few text messages here and there, but it's been really helpful. But either or, I think there's a lot of different options for you to choose from.
Also, remember to jailbreak your phone if you need to do that before you leave, and give yourself a couple weeks because some phone services take a long time to do that. And I did not know that, and so I didn't do that. And then I had to rent a phone when I got to the airport, and then I didn't have enough cash on me to pay. It was just a whole ordeal. So just make sure that you jailbreak your phone. It'll make things a lot easier. And then look up like how much the phone plan and everything costs. You have the right amount of cash in one currency. From a horror story of my own.
Any more questions? Yeah, so I don't know if everyone saw my message from the chat. So last year after our quarantine, most of us actually applied for a subsidy from the government, and we received 15,000 NTD dollars for that application. So you could also do that after your quarantine. So some of the money that you paid for your quarantine will be returned to you.
I think this kind of information Yang Shun said, OIA will maybe remind you to apply for it.
Yeah, so actually there are two applications. There's one in our university. I think that's 7,000 if I'm not mistaken. And there's also one from the government, which is 15,000. I think most of us applied for both of it. So that's around 21,000 in total. 22,000 in total. Any more questions?
I would just like to
Ask another
reiterate.
one. Oh, sorry.
Oh wait, were you gonna ask? Go ahead. Go ahead.
So I was just gonna ask, do we need a bank account immediately, or should we just open one whenever we need it?
I think after 1 month of quarantine, after 1 month, we applied for the bank already because for you to get the subsidy, the 15,000 and the 7,000, you have to have the post office bank. I think they're very strict about it being the post office bank, and as far as I know, all of us in our cohort use the post office bank, not the private ones.
Yeah, because
Especially if you get like a scholarship or something. Sorry.
Yeah.
Because in NTU, they will recognize some bank, so the post office will be the best option for you.
And it's actually just easy to open a bank. There's one inside the campus and one outside the campus, so it's not a problem at all.
But when you do it, like you can just ask someone who's done it before for help because it is kind of you have to like go buy a stamp and like you might need help with translation, etc. But it's easy once you've done it. But of course you haven't done it until you've done it. So just ask someone for help.
Also, if you're opening the bank inside the campus, I think most of the staff there speaks English, so it'll be okay.
Or you can come to find me. I can go with you.
Yes. Tom is very helpful. Okay, any more questions? Oh, there's one question from Danielle. For those who have used Amazon Prime, how long do packages take to come? Is shipping expensive? I never used Amazon. Anyone from us used Amazon before?
I've used Amazon. I recently used it. I ordered. It actually arrived before the expected arrival time, which was less than a week. So it's pretty fast. Shipping, gosh, I think it was like between $40 or $60, but if you spend over a certain amount of time, it is covered. Or like shipping is free. But it wasn't necessarily Amazon Prime itself. It was just like regular Amazon. There was another thing. Oh, and then like for customs, so whatever price you get at the end, they're going to include, or like the additional prices is for like customs and like having it go over the border and everything. So account for that as well. But in terms of timing, it's really fast. And I think for those, I haven't used Shopee, but I know a couple of you have, and I don't know what the shipping is like as well.
Yeah,
Oh,
for people who will use Shopee or other apps that's more familiar in Taiwan, I think it will only take 1 week to 2 weeks for your package to arrive. And the cost of the delivery will only be 50 NTD, so that's like around $1.
Jade has a question. Or was anybody going to say something? I was just going to read the question out loud. Jade says, sorry, I can't turn on my mic, but for the dorms, we only get the room for the semester, or is it for the year? I'm kind of worried about getting a mattress and not knowing what to do with it when the semester year is over.
Okay. I think for the Goching dormitory, if you already lived here, they will allot you the room for 3 years. So it will not be a problem. You don't have to reapply for the Goching dormitory. But for the Prince dorm, I'm not really sure how their dorm works.
I think it's the same.
And then with regards to the mattress is it's not like the kind of mattress that you would think of in the United States where it's like a big spring form mattress. It's essentially what I got is like a memory foam mattress topper. And I think it was around $30. So afterwards, I think a lot of people in our dorm, at least, you can just donate it. You could maybe look into selling it on some of those buy sell pages, but I don't know. Yeah, that's been my experience. And sometimes I'll just see like a mattress like outside in like the common area being after it was donated.
I agree with Jess. I actually got like a thicker memory foam mattress from IKEA. And what I tried to do was I heard that we didn't have a mattress as soon as we arrived to our dorm. So I was kind of worried that I wasn't going to be able to sleep on anything when I first got here. So I ordered my mattress while I was in quarantine, and it arrived the day that I arrived from the quarantine hotel. So I was able to like schedule that. But I guess it just depends what you're comfortable with. I did have to return it because there were some inconveniences, but I eventually just got like it's like a child size mattress because it's our dorms, the way that they're designed, like it doesn't really fit like a twin mattress per se. It's more like a slimmer, smaller mattress. But yeah, you can ask us more questions about maybe specifically the dimensions of the mattress or what our experiences are like. But also there was another comment. Go ahead if you were going to say something, Yangshin.
Oh, Jade said that she was placed in Women's 6 dorm by CPH. I think it's 4 people per room. But the application for the dorm is almost the same with coaching. You don't have to like reapply every semester for you to stay in the dorm.
There's another question. What have been your experiences with the dorms? Do most people continue to live on campus or move off campus?
Well, as you can see, Stephanie and I have the same background. We still live in Goching.
That is correct.
I think nobody in Goching moved out from our cohort.
From our cohort, no.
I think the main deciding factor is just cost, because it is a lot more affordable to live in the dorm compared to living off campus.
Yeah.
But you do have
cost? Oh, sorry. Steph.
No, I was just going to add to what Jess said. Like, even though you do live in the dorm, you do have the option to move out. So don't feel like because you're going to be here the full 2 years that you're going to have to stay in this one place. Like, that's why, I mean, Elizabeth would be a great resource to ask about off-campus housing after your first semester.
Yeah.
Mm-hmm.
So basically,
also, I think Renee moved out. Oh, sorry.
The cost of the dormitory in NTU is around 1 month or 2 month payment in outside the campus.
Yeah, the dorms are like obscenely cheaper than living not in the dorms. So if cost is, but that being said, rent here is also so much cheaper relative to the US if you're from the US. So it just depends on your budget and such. But I think Renee did move out of the dorm. So it also depends on your like lifestyle and like what you're looking for. But yeah, I did consider moving into the dorms just purely out of cost, but then I was like, oh, I can't do it. But yeah, let me know if you guys have questions about looking for housing.
And that's a good point Elizabeth brings up. It depends a lot on your living style. So if you know that you're the type of person that just really does not want to live with a roommate, then that's something to consider. Because the dorms are very well designed so that I mean, really, like, there's enough space for your things, but they're also a dorm, so it tends to be small as well. So if you know yourself, then you can at least, give it one semester, try it out, and then if need be, you can always make other decisions and choose different things. There's another question. Will our roommates be someone from our cohort / another international student, or can it be anyone? It really depends. My roommate is Taiwanese, so she's from here, but there are other people on my floor. There are some international students, and they're placed with other international students. I know that at least like our dorm director was working with some people on our floor, and they were asking them like if there's somebody from a specific country and they would like to be in a room with somebody else from that specific country, they could probably work something out. But that's a question you would have to ask your dorm director, and I'm not sure that they necessarily advertise that because they kind of just put you anywhere. But if you're a Fulbright student and you're staying in Goching, you do stay with the other Fulbright student, and you can correct me if I'm wrong, Jess, and you can speak a little bit more about that. But really, if you're not in Fulbright, then you can be placed with anyone. I think that was
I think actually, Winston, are you still here? Because I know that he had experience actually changing roommates. I'm not sure if he left. But
yeah, no, I'm still here. Yeah, so there's just because you're a Fulbright student doesn't mean you're guaranteed to be assigned with another American. I just kind of talked to the dorm director to see if I was able to switch with my current roommate. So yeah, it just depends on kind of how you go about it.
Yeah.
Thank you for clarifying.
I think there's another question. Has it been weird having a roommate during COVID? That's my number one concern. In our dorm experience, I think during the COVID, it's they're relatively safe. Well, you have to use your mask if you're going to the restroom or going to take your water outside, because the restroom and the machine for like water is outside, and there's also lunch, which is also in the public area. So if you're going to the public area, you are required to wear the mask, but inside the rooms, you're not really required to. I think Steph has more experience having a roommate during the COVID because I have no roommate.
Yeah, so my roommate, actually, when it first happened, a lot of Taiwanese students went back to their hometowns. So a lot of us were kind of left without any roommates, those of us that were international students. But my roommate, I don't know if you saw her in the background, but she is back, and she's been back for a couple of weeks. But if your concern is in terms of, it's like health oriented, like I know she takes care of herself. Cases are relatively low here in Taiwan. Like Liangshen said, if you're going out, you're always wearing your mask as soon as you exit. Some people, as soon as you exit your room, or even if you exit your floor, if you exit your floor, you absolutely have to wear a mask. But yeah, so I feel safe, even though it's two of us to a room. In terms of like the social aspect of it, I tend to be very introverted, so I like my own space. So that part has been a little bit challenging, but regardless, my roommate is great, and we are managing as best as we can with the current situation. But I'm not sure where the concern lies per se, and if you want, you can explain a little bit more about that. But health-wise, like, it's okay, and the social aspect too, like you can handle it.
Yeah, well, basically, no one can enter the dorm except the residents, so it's relatively safe. You also have to check your health, your temperature before going in, so it's like completely like guard out.
Yes, and I would also say, so if you live in Gocheng, every even floor has a little kitchen area. Odd floors do not have it. So I live on the 9th floor, Jess lives on the 8th floor. So if I want to heat up some food in the microwave or use a little toaster oven or anything like that, I would have to either go to her floor on the 8th floor or go up a floor to the 10th floor to be able to use that common area. But I always wear a mask whenever I go to the different floors. And I've seen some people also in the common area wear a mask. And also there are signs saying that, you know, just be cautious, wear a mask when you are exiting in and out of the different floors in the dormitories.
Yeah, well, basically, if you go out of the dorm, you need to wear your mask because you have to pay a fine if you don't wear your masks.
Any more questions? If you don't have other questions, then we will end here. Thank you for attending today's orientation. But if you have any other questions afterwards, you can contact me by email directly. Then we will respond as soon as possible. Okay. Thank
And
you.
also ask your buddy if you have questions. We're here to help.
Thank you.
Thank you, everyone. Have a nice day to you.
All right, excited to meet you guys. Bye-bye.
Bye.
Bye.